Well, hi, this is Sarah Russell, and I'm really excited to be here today with Nicole Seal, my colleague. And I would love, Nicole, for you to introduce yourself.
Hi, Sarah. I'm really excited to be here with you too. I think this is going to be a really cool conversation. I am currently a nutritional therapy practitioner. I've been practicing in that capacity for about 5 years now. And prior to that phase of my life, I was a counselor. So I studied human psychology and counseling in academic settings. And I'm in the midst of a really amazing educational endeavor right now. I'm studying to become a women's health nurse practitioner at the Yale School of Nursing. And so I'm coming to this conversation wearing three different hats, and I hope that that's provides value as we talk about all the things we're going to talk about today.
Yeah, absolutely. Yeah, it's really great to have your multiple perspectives on board for this conversation. I have been a functional nutritional therapy practitioner for the past decade, and I came, like you, kind of from an academic background before being in the world of nutritional therapy. I was teaching Italian language, literature, and culture at UC Berkeley, and I've always loved research and have brought that love with me to my nutritional therapy work. Um, One of the populations I serve is people who are in the preconception, pregnancy, and postpartum stage of their health journey and life journey. And I feel really passionate not only about supporting my clients, but about supporting practitioners working with this clientele. I think it's really important for us to try to deliver the greatest value and really depth and breadth of service to this clientele, because this area of health is really the most impactful throughout the lifespan. I mean, especially when we think about preconception, it's the one area where we can affect the life and health of future generations in the work we do with our clients who have not even yet conceived. So it's amazing.
I couldn't agree with you more. I stumbled upon the concept of epigenetics maybe 7 or 8 years ago. I was privileged to take a course in behavioral endocrinology at Connecticut College, and my professor was just a brilliant, kind of ahead of her time researcher, and she introduced me to this concept, and that is really what got me thinking about becoming a healthcare clinician, because just that knowledge that we can change the health of future generations by ensuring the health of a couple trying to conceive. It sparked this huge interest in me. And it took a long time for me to figure out exactly how I was going to serve people in that context. But that's been the goal for a long time. So I agree with you wholeheartedly. This is an
Yeah,
amazing time of an amazing phase of life to be able to help people achieve health.
most definitely, and an amazing time in scientific and clinical developments in these areas. So even just thinking about the overlap and intersection between psychology and nutrition, for example, is absolutely fascinating.
It really is.
Yeah. So today we're going to talk mostly about prenatal nutrients, and
Mhm.
um, there are a few things that would be good to cover. And why don't we start with one of the most controversial areas right now, which is iron supplementation during pregnancy. I'm curious what, kind of what your perspective is on the topic and what some of the dangling threads that are open for you might be.
Well, it's certainly many dangling threads, and I am always fascinated by this conversation because there is so much controversy. And I think iron metabolism is one of the most complicated topics I personally have ever approached. So I won't claim expertise, but I think this is a kind of interesting place where I can share perspectives from different care communities, both the medical-based community and the more integrative or nutrition-based community. So when I think about iron supplementation, especially prenatally, I think first about the medical context there, because there is a huge emphasis in medically based obstetrics and midwifery care, and even more holistic midwifery care, to make sure women who are pregnant have sufficient iron. And I think from my understanding of the research, there's an incredibly important reason for that, right? When we think about what iron intakes nationally and globally, we are talking from two different countries. So I think my reference point is the United States, but I do feel like this applies to a lot of industrialized nations. I think the latest research I have come across states that the average woman is consuming about 12 milligrams of iron per day in her pregnancy, and the recommended daily allotments are close to 27 milligrams per day.
Yeah.
We already see this huge differential between what is coming in and what's needed for healthy, the maternal side of pregnancy, but also fetal development.
And the placenta, right? I mean, the placenta needs a lot of iron too.
Mm-hmm. And just the physiology of pregnancy is one of incredible proliferation, right? We're trying to upregulate the amount of red blood cells in the body by an enormous amount. And I think it's a period of time where the need for iron is clearly higher, just because the structures that we're trying to create for oxygen delivery are in need of that iron. So if you have more red blood cells, they each require a certain amount of iron to be functional, and that oxygen is incredibly important for fetal brain development. And so medically, when in the midwifery context, when we're trying to determine the need for iron supplementation, there's a huge evidence on interpartum prophylaxis. So in midwifery circles, you will definitely hear providers emphasizing iron supplementation prior to pregnancy, which I think is a really valuable concept, especially for multiparous women who had a pregnancy, perhaps didn't experience iron sufficiency during that pregnancy, perhaps experienced some postpartum bleeding or even hemorrhage. So there's an element of iron loss, and then are attempting to conceive another pregnancy and develop another healthy baby. And then throughout pregnancy, there's a huge amount of attention paid to tracking a woman's iron status. And there are adjusted metrics for that, which I think is something that is not broadly understood, but we do account for the fact that there's some physiological hemodilution in the second trimester, moving into the third trimester, and we expect a woman's hemoglobin and hematocrit to decrease and then rebound a little bit. And so when we're looking at deficiencies, it's my instinct that we're not sort of jumping the gun or overshooting, but we really are looking at that deficiency within some nuanced context. And so the recommendations for iron supplementation come from that understanding that there is going to be slightly lower iron at certain points in pregnancy, and that's okay. But we're looking for dramatic decreases that would make compromise the health of the mother or the child, or make delivery potentially unsafe if there's a lot of blood loss.
Yeah.
So that's something I think about. And I think an interesting trend both you and I have noticed in perhaps more integrative circles is a little bit of a shying away from iron supplementation during pregnancy. I'm not 100% sure exactly all the factors that drive that perception. Maybe concerns about toxicity or quality of iron supplements, or the perception that you can get enough iron through your diet. So that's definitely a dangling thread for me. Like what is driving this idea that we don't need iron supplementation, or that it's dangerous?
Sure. Yeah, I think that there is a little bit of a bias in our kind of holistic health community. I see this a lot right now, a bias towards imagining that most people or many people will sort of trend towards iron overload, and that is really not a sound bias. Particularly, it comes from looking at reference ranges for minerals from a male dominant perspective, and certainly not from a pregnancy oriented perspective, because male versus female needs and normal levels of minerals like iron and copper are absolutely not the same. And a woman's levels of iron and copper are different, in pregnancy throughout each trimester of pregnancy. And copper fluctuates even throughout the menstrual cycle based on levels of estrogen and progesterone. Particularly, it kind of follows estrogen. When estrogen rises, so does copper. So I think there's a little bit of a bias in the holistic health world about iron and copper toxicity and fear of oxidative stress as a result, that errs on the side of harming maternal and fetal health, unfortunately, assuming a lot of the time that liver capsules are going to be a sufficient alternative to prenatal supplements that contain iron. And then there is the other side of the coin, which is some research about iron homeostasis in pregnancy, which is very, very interesting. So there are some unanswered questions about how iron homeostasis functions in pregnancy. And one of the things that has been noted is that when iron is not deficient, that the homeostasis can be disrupted by just, applying iron supplementation when it's not needed or before it's needed. But from all of my clinical work and from my research, I definitely agree with you that going into pregnancy in an iron deficient state is absolutely a risk factor for maternal and fetal health. Another population besides multiparous women at risk for iron deficiency is very athletic females. So a high level of physical activity does cause people to tend towards iron depletion. So I learned this because in working with very athletic females, I've seen levels of iron deficiency in the first trimester that I ordinarily would not expect to see in my clients. So that has been really interesting to learn about. I really like to look at people's iron panels before they even try to conceive. Ideally, I really want them to go into pregnancy already in an iron sufficient state, so that their bodies are well positioned to regulate iron throughout pregnancy. And then I like to look at the iron panel again in each trimester, just to see what's going on, alongside obviously the complete blood count. Looking at these values from the perspective of pregnancy reference ranges by trimester.
Yeah, I think it's so valuable to be able to take our clients and our patients as individuals. And it's really interesting. You brought up so many interesting points about just honoring the biological differences between men and women that can lead to differences in iron metabolism. And I actually did not know that athleticism or extreme athleticism could be a factor for iron depletion. There are two kind of conditions or situations that I often see that also can lead to iron depletion pre-pregnancy. One is the tendency for heavy menstrual bleeding. And I think that can be an overlooked condition, because it can be very difficult for a woman to objectively report what is heavy menstrual bleeding. And I think just generally, we don't have a very good way of tracking the amount that one loses in a menstrual cycle. I think technology like menstrual cups make that a little bit easier, but when we're using other products like pads or tampons, it's extremely difficult to estimate. So many women don't even fully know that their bleeding has been heavy for maybe 10 or 15 years before they are trying to conceive. And another condition that I have worked a lot with is people who have previously eaten either a vegan or a vegetarian style diet, which I think is a common condition for someone to come to a nutritional therapist being in that state. Generally, these would be people who are incredibly health conscious and interested in nutrition as a health promoting modality. And so it's not uncommon to see a client who has spent 10 plus years eating a diet that contains incredibly low levels of iron.
Yeah.
And so both of those conditions can on their own cause low iron. They sometimes come together, and sometimes, now that I think about it, come packaged with high achievement and high athletic
Oh,
performance
yeah.
and those other drivers. And so it's so important to look at, like, really find those objective measures like blood work so that you can fully assess the status of the person who you're supporting. And in the absence of that, like a really thorough health history where you're fully understanding the conditions of their life is super, super important as well.
Yeah,
Yeah.
absolutely. I think those are really good points. And of course, if anybody comes into a pregnancy with celiac disease that hasn't been properly diagnosed or managed, that is also a risk factor for iron depletion.
Yeah, so we're getting into some, like, all the different potential mechanisms that could cause poor iron stores in the body. So inadequate intake from the dietary side, or excessive loss from the blood loss, or potentially like metabolic activity and athleticism, and then poor absorption from the digestive concerns standpoint. There's another that comes to mind for me, and I think it can be tricky to talk about these situations because the more integrative community, I think, often assumes a little bit of higher level of privilege to our clients, but people who are in an economic situation where they don't have a lot of choice as to what they're able to eat, I think also become at risk for this kind of deficiency, because the
Yeah,
foods that are the highest in iron, animal protein, are the most expensive and also the most difficult to prepare and to access when you're on a really limited budget or you have limited cooking facilities or opportunities. And I think it's interesting to note that there are large populations of people for whom there's some invisible food insecurity. For instance, even amongst my classmates at the nursing school, a lot of them are students, single students without huge levels of family support, and they're attempting to be in a new city, pay their tuition, pay their rent, work for free. And that really sets up kind of a challenging situation where they're not necessarily having access to abundant iron-rich foods. And yet these are some extremely healthy, young, educated, privileged people kind of on the
absolutely.
outside. And so
Yeah.
we have to be super conscious and aware of those things.
Yeah.
Like really put our detective hats on when we're talking to our clients about maybe what has been their life history. So if you were,
Yeah.
in an academic setting where you for 10 years were a student trying to make it with very little economic access, even though you might have a great diet now, there should be some clue in your practitioner's head that that would be a risk factor for you. They should explore.
Absolutely. Yeah. Even even thinking about very health conscious people who are looking to source high quality foods, they might be shying away from animal products that aren't organic and pasture raised. And actually the quest for foods that are, it's that whole what do they say, don't let the quest for perfect get in the way of the good, or something like that.
Yeah.
That is such an incredible example of it. Sometimes just aiming too high can cause people to to source foods that are less nutrient dense. Sometimes it is helpful to help educate our clients in compromising. So choosing nutrient density, even though it might not be, the most optimal sourcing. And so, yeah, I mean, when I take a history from my clients, I like to have them complete almost like a little autobiography where they tell me a little bit about what their life circumstances were and what their eating and health were like, starting with preconception, basically what do they know about their parents' eating habits, health, and just general life circumstances before they were even conceived, and then what they know about their infancy, and on and on. I mean, not everybody will have all that information. I have a number of clients who have been adopted and just don't know about their parents' history. That is also an interesting piece of clients' history, is the gaps. They're not necessarily to be looked at as a deficit. It's interesting information, even when you have no information. It is really useful to gather that information, because then we know what people came to their current situation from, and then looking at their food journal from today, ideally, not just a food journal, but when possible, obviously not in situations where it's going to be traumatic or stressful for a person or difficult for them to do, but when it's possible, to have them compile their food journal in an app like Chronometer, where we can actually see a good estimate of the macronutrients and micronutrients, including iron, can be incredibly helpful.
Yes, I so agree. And it's one of the great privileges of being able to work the way we do, having that more extended time with our clients. And it also starts to paint a little bit of a picture for why the medical system has to take some things by proxy. So, in a culture like the United States, where medical care is not a human right yet, and insurance dictates the amount of time providers have, sometimes there's just, I would say actually all the time, there's just not time to delve into health history with a patient at a medical visit. And so a provider is faced with this really, it's a challenging choice. They either have to recommend the iron supplement in absence of complete information, or they have to say like, oh, I don't know exactly what's going on, so I'm not going to recommend the iron supplement. And the truth is that the consequences of not recommending that iron supplement can be really high for the mother and the baby, and so they have to err on the side of caution. And sometimes the practice is to prophylax with iron before we have labs. And it's not that the labs never get sought or read. It's just that there is sort of an urgency, and we don't want to lose people to follow up, and we don't have all the time and the resources. So that's this moment of misunderstanding, I think, between the medical system and the more integrative communities that we work in, where sometimes we look at the medical perspective and we think, how could that be the general practice? It maybe isn't the most perfectly responsible practice, but it really is honestly the most responsible thing to do with the resources they have. And same for recommending forms of iron supplementation, which I think this could be an interesting just back and forth for us. But there's quite a bit of liability involved with asking someone to put a substance into their body. And so a medical provider it's really incumbent upon them to recommend things that have been FDA approved. And so an iron supplement that has been produced by a pharmaceutical company will have been FDA approved, which kind of limits the forms of iron that are being offered to people, and maybe perpetuates some of the negative connotations around iron supplementation. So iron, ferrous iron, or iron sulfate, these forms that people have bad experiences with, they cause indigestion and constipation, and sometimes you have to take them in incredibly high doses to get results. The the biggest reason for that is because those are the forms that have been sort of stamped as safe and are also financially accessible to all people.
Yeah.
So that's really interesting. I have definitely had better results clinically in my nutrition practice with other forms of iron.
Sure.
I'm wondering if you like, what has been your experience with
Yeah.
forms of iron?
Yeah. I mean, this is such a great topic, because I really sympathize with the public health oriented viewpoint, which it aims to cover as many bases as possible and with the most efficiency and parsimony available, which is an incredibly important perspective. So we come, like it covers the needs of, the vast majority of a very large population, which is incredibly important. I mean, it's invaluable. And then, when that's the medical viewpoint, and it's incredibly important. And it's a great service to society as a whole. And then we have the other perspective, which is holistic care, which we often view in opposition with the medical viewpoint. But I think it's so useful just to see them as complementary and cross-pollinating and usefully dialoguing with each other, which is, let's look at each individual. Well, let's be honest, what individuals are coming to us and paying us for individualized nutritional care? The people who can afford it. So those people have the privilege, and we have the privilege of serving them within a completely different framework that can, however, be complementary and superimposed onto this other framework, which is more the public health framework, where we try to cover as many bases as possible, just basically applying a one-size-fits-all protocol. It might sound awful, but it's life-saving to large populations that could never afford to come to us. So I think that we don't appreciate this enough. And that, when we as holistic care providers scoff at this viewpoint, we are scoffing at people who can't afford our care. And that is incredibly awful when we think about it. I mean, we've all been there. I mean, most of us have. I certainly have, like large portions of my life. I've been one of those people who couldn't have afforded nutritional therapy. How could I possibly presume to scoff at that population and the people who work so hard to serve that population and keep it healthy and guarantee the best possible maternal and infant outcomes? So, I mean, yeah, clinically, I've seen really good results with prenatals that contain iron bisglycinate versus, ferrous sulfate. I've also had really good results with Flora-Vital iron and herbs, which is integrated basically with cofactors that help absorb the iron. But realistically, we're applying those with people who can afford to come to us, get individualized care, have their labs individually interpreted, and that's all well and good. It's terrific. But let's also acknowledge how terrific it is for people to be getting the life-saving one-size-fits-all care that we so often scoff at.
Yes, and how difficult it is to move the needle on that one-size-fits-all care, even when there is some compelling data that would suggest, oh, we have a great other additional option. I remember early in the semester, I shared a white paper with a professor around iron bisglycinate, because there was like a really rousing class discussion about how patients often do not comply with iron supplementation because it is so like unpleasant physically. And so there are a lot of strategies that have been developed, like every other day dosing, or sort of micro dosing throughout the day to try to like reduce the burden on the digestive system. And I shared a paper that examined iron bisglycinate being effective at preventing iron deficiency anemia at a lower dose. So half the level of elemental iron, which is fascinating. So clearly there's an absorptive benefit happening there with like a massive reduction in GI complaints. And my professor was so interested, but her reaction was, this study is so small.
Yeah.
I think there were maybe 90 subjects in each treatment group. And I, from a nutraceutical perspective, I thought that is a brilliant study. We have just the fact the research has been done, and there were close to 200 subjects in the research. But for medical guidelines to be changed, there have to be really incredibly massive trials done with different compounds, and the funding for that just isn't happening. So even when providers have an interest in shifting the paradigm a little bit, or bringing something more integrative into their care toolkit, they are in a lot of ways limited by what gets approved and the robustness of the data that they're able to look at, which is less of a problem with individual providers and their motivations and their intentions. And I think maybe more of a problem of our funding apparatus for health research, and how all these things trickle down and get communicated. But certainly the providers themselves really have a strong interest in giving their patients the most efficacious therapies that are the least likely to cause side effects or non-compliance, because they want people to be well. And they really need that to be accessible to people across all economic situations, and all geographic situations as well.
Yeah. And, I think that one of the things that is holding medical practitioners back from recommending forms of iron supplementation that hasn't been as extensively tested as ferrous sulfate is the concern about liability. What if something bad happens to my patient because I put them on 27 milligrams of iron bisglycinate instead of the recommended ferrous sulfate. If there's an adverse outcome, it's my fault, and I'm liable, and I could be sued, and I could lose my license. And so there's a fear factor that holds people back professionally, in addition to the desire to hold up evidence-based research, extensively researched, time-honored methods. So there is, unfortunately, not as much investment in studying the effects of herbs and supplements. I just said herbs because I was thinking about, this is another area where there are so many gaps in information on what herbs are safe during pregnancy. So, we can get terrified even of, just normal culinary herbs, and yet, some herbal teas that are available without any kind of warning label could be quite dangerous in reality. So we do need to be careful. But a lot of the time, I think the concern for liability can be immense. I mean, I think one of the other prenatal nutrient forms that is subject to this same standard in allopathic versus holistic care is folate, because the form that is most researched is allopathically used is folic acid, versus what we often use in the holistic context, which is active forms of folate. My preferred form is actually calcium folinate versus methylfolate. But yeah, I think that the same reasons, I see this, a lot in the European context, in addition to the, even more, I think, than the American context, this concern about, these alternative forms of folate that haven't been as extensively tested in the scientific literature, and we just can't use those.
Yeah, I have experienced some interesting stratification in attitudes, especially around folate and folic acid. And I'll just caveat this by saying, I don't think the opinions of the, more handful of providers I've been able to interact personally with necessarily represent everyone in that particular profession. But What I see more often than not is in obstetrics, which these providers would be medical doctors who have done extensive postgraduate training in high acuity maternal care, so maternal fetal medicine, obstetric surgery, etc. There is a pretty strong commitment to using only the FDA approved sort of folic acid forms. And it really is because they have been the most studied forms.
Yeah.
In more medical midwifery circles, there's a little more flexibility. There's a lot of kind of like a groundswell of information about the value of different forms of activated vitamins. And so while not every midwife would like stand up and say like, yes, I'm an expert in these different activated forms of vitamins, if a patient comes and says, I want to take this prenatal with an activated form of the B complexes will all be activated, the midwife is going to be less likely to say no, that's not the one you should take. But they will say like, don't stress about taking the perfect form. Like there is kind of there's a give and take. Like you can take that, but I'm not necessarily making you take it, right?
Sure.
Like so you use your as a patient can exercise your rights. And then in more holistic midwifery, so people who are providing hybrid care in and out of hospitals, maybe professional midwives rather than nurse midwives, there is a definite increased attention paid to forms of nutrients. And in general, I've noticed these providers are really tuned into either activated forms of nutrients or food-based, not food as prenatals, but food-based forms, nutrients in prenatals. And above and beyond that, they do emphasize health of the diet. And I think that group of providers has the most close analog to like the nutritional therapy model, where they have the great privilege of like lots of time with their patients, which is that really is the opportunity for education, for understanding someone's situation. But yes, you can tell that where liability is of like key importance, in some of the more highly regulated forms of reproductive care, there's much more emphasis put on using those well tried and true proven forms of nutrients. I just have found that to be really interesting as I've talked with many different providers from different, sort of walks of the profession.
Sure. Yeah. One of the things that I've noticed in my clinical practice is that when I'm working with a client who has an allopathic provider who is coming from this dominant allopathic paradigm, the provider isn't recommending prenatals with activated forms, but when I do, they have no objection. So it's almost like, okay, this is fine. I'm not worried about my client's health and safety, but it's not my responsibility because I wasn't the one who recommended this product. So I feel like they've been relieved, and they're not concerned at the same time. So I think there is a growing awareness that these active forms of nutrients, the same thing goes for prenatals with iron bisglycinate, that these are not concerning to the physician for the sake of the health of their patients. It's more of a concern for their personal liability, which I completely sympathize with. I understand. I mean, it's being in the medical profession must carry an enormous burden that we in the holistic world just can't understand or appreciate because we're just not in it.
Yeah, it's something I'm coming to appreciate much more. I'm sure I'll appreciate it so much more when I'm fully in clinical practice. And the other component of this liability is sourcing of these ingredients. So I know this is a question we grapple with in our integrative community regularly. Like, how are the supplements we are recommending being produced, sourced and produced. And even amongst ourselves professionally, we have, shared and researched different brands that have, more rigorous third-party analysis. And we have a better confidence of the margin of safety associated with those ingredients. But when you've been trained in a medical model and you have really had to focus on understanding other stuff, not about supplements, you don't necessarily have the bandwidth to learn everything about the supplement industry to make a healthy supplement recommendation. And so that can be a source of fear too.
Absolutely.
Around like what is the quality of this nutrient? Have these minerals been contaminated with a heavy metal? Are there other pollutants? Is the thing in the bottle even what the label says?
Yeah, do the nutrients
concerns.
match the dosages? Because there have been cases where, for example, there's a certain amount of vitamin D on the label and the product has a lot more, and then somebody has an adverse event. So these things can happen, unfortunately.
Really can. And they can happen with pharmaceuticals as well, but there is like a well-trod process for dealing with the consequences of a pharmaceutical concern like that. And it just doesn't exist quite as clearly for herbs and supplements. And that's why we're so personally, we are so accountable and so conscientious, but making a recommendation to someone to go find a prenatal vitamin at a health food store can seem like a massive liability to take on for someone.
Oh yeah.
I think it begs the question though, like we were talking about using food or food as supplements, for instance, like liver capsules as prenatal nutrients, which that has become a little bit of a perhaps a trend.
Yeah.
And I sometimes think about how those principles of purity, sourcing, etc., apply to those products as well. Like I don't think that they are free of those concerns. Would you say that?
Absolutely. Yeah. Yeah. I'm actually very concerned about the trend in the holistic world away from recommending a prenatal multi-nutrient and into assuring pregnant people that it's fine just to take their liver capsules and everything will be all right. I mean, first of all, there can be a variation in the amount of nutrients in each liver capsule. And they can't test every single batch. And then contaminants could potentially be in the product, and there just isn't the same variety of nutrients in liver as there is in a broad spectrum multi-nutrient supplement. So while I think that it is theoretically a really nice idea that we should be able to get everything from our food and food-based supplements, in reality, that is just not immensely realistic right now. And some, a lot of the time people say, oh, well, our ancestors they only ate food. There were no supplements. There were no prenatals, and they were fine. Well, when you look at the history, I mean, I come from a background where the area that I researched was medieval and Renaissance families. And so there were a lot of people who had physical and mental ailments. There were a lot of miscarriages. There was postpartum psychosis. There was all kinds of stuff that we kind of forget now because we don't see it. It was back then, and that's not really what we have in the front of our minds. But people had genetic diseases, nutritional deficiencies, and all kinds of problems back in the day when they were just eating food. They were not exempt from it then, and now we live in a much more toxic world. And not only are there more toxic things that people are eating, breathing, drinking, and absorbing from all kinds of sources, from their cash register tape to, the packaging of their food, even their wonderful organic food. still has packaging a lot of the time. And soil is a lot more depleted than it used to be. So the levels of nutrients in foods are in many cases just not the same as what they used to be, even in the good old days when there were still problems with nutritional depletion and all kinds of diseases caused by it.
Yeah, absolutely. And it seems fair to say that the people who are the most vulnerable to these sorts of toxic exposures and nutrient depletions or deficiencies are the people with the least amount of resources often, right? And so
Yeah.
we just have to be ever conscious of making these blanket recommendations that demonize something like a conventional prenatal from the pharmacy as something harmful to a pregnancy or a baby, when we don't, if we're not being totally aware of the life circumstances of the person who really needs to take advantage of that resource, because as you said before, is absolutely life-saving, along with some of the like fortification programs we have for our public food supply. The reason for all of this is it the world's most perfect and elegant solution? Perhaps not, but it has helped people in an amazing way to have added iron to the food supply, added vitamin D to the food supply, added B vitamins to the food supply. That solved a lot of really pervasive health concerns that we didn't have a good resource for before.
Absolutely. Yeah. And when we're talking about a population where somebody may be grappling with choosing between paying for a high-end expensive multi-nutrient supplement versus getting the one covered by their health insurance and being able to have more money to buy healthy whole foods, I mean, those are really important concerns that we need to understand as providers. We need to understand the reality of people's actual budgets and not come into this with the let them eat cake mentality, which is just really not helpful to anybody at all, and it can be very harmful.
I completely agree. I feel like we've talked for about an hour. We could talk for 5 more.
Yeah.
I don't know what your thoughts are, if you want to keep chatting about nutrients, or if maybe we want to have like a separate conversation. We covered iron and folate pretty well, or maybe we chat on another occasion about the other nutrients. What do you think?
Sure. Yeah, that would be great. I think that maybe a lot of people's bandwidth might not accommodate much longer than an hour. So yeah, it's been really great having this conversation. I'm actually greatly looking forward to the next one. And
me as well. I enjoy every time I speak with you or hear something you've said or read some of your writing. It gives me food for thought and also some fun things to go research. So I feel like I'm learning from you all the time, Sarah, and I just think that we have a lot of good perspectives between the two of us to share, and I am very excited to chat more with you about this stuff.
Yeah, likewise, Nicole. Absolutely. Thank you so much for taking the time for this conversation. It's been a real pleasure.
Yes, likewise. Absolutely.
Yeah, thanks.
All right.
Bye.
Bye.